Hi, my name's Kate Skinner. I'm a physical therapist and I have hypermobility. And I specialize in chronic pain and complex conditions, including hypermobility. My first question is, do you use a chiropractor? Does it help? And is it recommended for hypermobility? And chiropractic is primarily known for joint manipulation. And so within the chiropractic profession, there are a variety of practitioners. And so depending on your practitioner, the answer can really vary. And so what I'm going to talk about more is joint manipulation in general, because there are other professions like physical therapy will also do joint manipulation. Osteopathic will do joint manipulation. And really the answer is the same for all of them. So the big thing that you want to know is that less is more. And when you're already hypermobile, having a lot of force going through your joints does not tend to be helpful. And so if you're going to work with any provider who provides joint manipulation, you want to make sure that one, they know that you have hypermobility, and if they are not really used to that, don't understand that, the other thing you can tell them is that you're sensitive, because everyone understands if someone's sensitive, they're going to do less. And so that's really what you want. You want the least amount of treatment that's going to give you the results that you're looking for. So you also want to make sure that if you're going to have a manipulation treatment, it is specific. You want someone to actually assess what you need and treat you where you need it, not just treat everything. Because a lot of times if you get extra movement going through places that don't need it, it's going to flare you up and give you more muscle spasms. So you want to be careful about that. You also want to check and see if your symptoms change and how long they change. So if your symptoms are better for several weeks after a manipulation, that was a great treatment for you. If they're only better for about 30 minutes and then they get worse, that is probably not the treatment that you need. And so you want to be able to work with your provider, if it's a chiropractor, so that way you're getting the type of treatment that you need for your body so that you have the best results. The other thing you want to look at is sorting out strain versus a restriction. And this is kind of a tough thing to look at, because if your joints are locked up and that's what's causing you pain and you can't move, like manipulation can be super helpful in that area. But if you have actually strained your neck or your low back, that strain, like manipulation, nothing is going to help when it's a strain problem. The best thing you can do is rest, leave it alone, and usually it takes 5 to 7 days, which is a long time for something to settle down. But I have not been able to find a faster way through it. And to give you an example, I've had a couple of instances. Sometimes there are things that you know. It turns out that jumping on a trampoline and landing on my back, not the best thing for my neck. And so it strained my neck. And I got off the trampoline and I was stiff and I couldn't hardly move. And when you have those pain patterns, especially when you wake up the next day and go, oh, this is going to be bad, you will do anything to make yourself feel better. And if someone can just pop it, get it to work better, you think it's going to help so much. But a lot of times when it's a strain thing, it won't. And you'll know, because somebody will adjust you and you will not feel any better afterward. Those are cases where they can be giving you the best treatment, but it's just going to take time. And like I said, a lot of times those are 5 to 7 days. It's just a slow process of healing and recovery. And the best thing you can do is actually not stretch, not manipulate, ice or heat it, leave it alone, lie down, and just let it be.